Time is often treated as a natural curative force in clinical thinking. Wait long enough, the argument goes, and disease fluctuations will average out and stabilize. This belief confuses two different things. Averaging across many patients stabilizes the population estimate. It does not stabilize any individual patient's trajectory. A single patient moving through disease time does not benefit from the law of large numbers. For a disease process with independent progression increments, each period contributes its own variance to the patient's accumulated state. The variance of the patient's state equals the sum of per-period variances. Over many periods, total outcome variance grows in proportion to time. Neither quantity decreases with longer follow-up. Time adds clinical uncertainty. It does not remove it. Independence of disease increments is the mechanism. When disease steps do not cancel each other out in expectation, their variances add without reduction. A disease process with no mean drift still accumulates outcome variance at every interval. The population mean may remain stable. The spread of individual patient trajectories does not. Outcome variability is not a temporary clinical deviation. It is a structural property of individual disease progression. Consider a cohort of patients starting at the same clinical state. After one interval, the range of patient states has 1 unit of spread. After 4 intervals, the range has doubled. After 9 intervals, it has tripled. The cone of possible patient states expands as the square root of time. No individual patient converges to the population mean in their realized trajectory. The spread grows permanently. The law of large numbers governs population mean estimates, not individual patient states. The sample mean outcome converges to the true population mean as cohort size grows. The individual patient state does not converge. A clinician averaging outcomes across patients gets a more precise estimate of population risk. The actual patient's disease state still faces growing individual variance. What stabilizes and what is at clinical risk are not the same object. Time can sharpen a population-level estimate of disease progression. It cannot reduce the variance of an individual patient's realized trajectory. For any single patient following one disease course, longer follow-up means greater accumulated individual uncertainty. The expected population outcome may be favorable. The individual patient's realized path may not be. Time amplifies individual clinical exposure. It does not absorb it.